So I'm going to be talking today about Raham Project, which is something very, very dear to me. So I wanted to share what we've been doing with that platform with you all. So I'm going to initially go through a little bit of an introduction of who we are, what our aims are, and just a few more interesting details. So this is our second annual report that shows the activities that we've carried out in Raham Project between April 21 and March 22. So we're a grassroots organisation and we began in July 2020. And I am very excited to share that, in August we registered as a community interest company formally. And this was a really big step for me because I'm not a business person by nature. I am a midwife by nature, and I've had a steep learning curve through doing all of this. But it was something that my community really needed, and I felt like this would really help them. So that's why we did what we did. What are our aims? So this is going to look a little bit about what our aims are. So Raham Project's aims are to create a safe space that's non-judgmental, particularly for mothers and partners from ethnic backgrounds. We want to start creating a space where things represent our communities a little bit more. So we've started creating digital media content around the perinatal period where we use key messages and images representative of people from within our communities in a very kind of easy to understand way. And with this, what I found is actually lots of people are accessing it, not just necessarily people from our ethnic communities. There's lots of mothers from, Caucasian communities who come and tell us, nobody told us that. I wish I'd known that before. So I feel like it's spreading wider than I was planning, which is always a positive. Creating a support network is really key for us. So something that we started doing a couple of months ago was we created our own Facebook group. That's a private Facebook group run by mothers from ethnic communities for mothers from ethnic communities. Raham Project actually started during COVID, so social media was our way to connect with families, and obviously it was something that clearly was needed. So we've continued to grow. Awareness. We're trying to raise awareness about the perinatal period. We really want to, focus on maternal mental well-being. And I'm a huge believer that we could prevent a lot of the trauma that our families are suffering through good education, really good support during their pregnancies. And I feel like, we can help with that. Another aspect to that is raising cultural awareness training for healthcare professionals. So it's not just about looking at how we can support people who are having babies. It's also about making sure that the people who are providing the service are also mindful and aware of the nuances that people within my cultures face. So it's bringing both of them together. I think that's really, really important for me. And I guess that puts me in a really valuable position, being a midwife who sees how the services work, and also being somebody who's grown up within my local community, and I've known how my communities have networked and they taught me their ways of life. So I think marrying them two would be really powerful for a lot of families out there. All of the information that we gather together from Raham Project, we use that to feed back to our local maternity neonatal system. And that helps them try to, shape our local services, which I think is really important, that we have our voices raised in a way that we can start, creating real change in a system for them. And something that's come a little bit later down the line for us is advocacy. And I think this is a really key thing for us actually. When families come to us and they engage with us, it's about understanding that culturally, often there's a lot more hand holding required. So that can be simple things like reconnecting them to maternity services, supporting them raise their concerns, sitting there and listening to them. If they really asked and they wanted us to turn up to an appointment with them, we would. But we have a key aim of making sure we're closing this loop. Maternity services have the power because they are the biggest organizations that provide maternity care to families. So they need to understand that there are service users who have a need, and if they're not feeling comfortable speaking up for themselves, then they've got other people like us to help support them. But it's really important that they're listened to. So how have we achieved the aim? So I've probably mentioned a few of these already. Social media is a really big way that we kind of target our communities. And some of the things we've started doing with our digital resources is we're trying to make them more reachable by creating them in languages that our local community understands. So Midwifery and Urdu are two very commonly spoken languages within our Peterborough-based community. So we have started using that, and I'm hoping that as time progresses, that our longer term goal would be looking at, securing funding so that we can start doing that in other languages, which would be really, really, really good, I think. Our listening events are offered every month, so we consistently offer an online listening session to mothers that wish to join and share their maternity care experiences in a safe and non-judgmental space. And we promote them every month for families to join. And as we've consistently stayed there, I think we've developed this trusting relationship, and people are beginning to hear about us, and people are coming to join and share their experiences with us. Signposting and advocating for families has become a very important thing, like I said, about raising their concerns and their voices and making sure that they have that support there to be able to share what they're feeling. And I've already mentioned the Facebook peer support group. Now, this is just some interesting information about our social media. So we've had like a 50% growth in the last year, which means lots of people have started following us and accessing us. And these are some of the infographics that we've created in recent times. And these are some of the ones that people really have wanted to see more kind of content in this sort of format. I want to say thank you to all of the other organizations that are out there and have supported us in our social kind of world and shared our content. And since January, when we started creating these more more representative infographics, we've had lots of organizations come to us to ask to use these in their hospital areas or their birthing centers. And I think it'd be fantastic if they could be shared as widely as possible, because we need this sort of information out there for families and also for staff to have as well, because a lot of the people that come to us are actually midwives who have just qualified or student midwives. I'm going to skip all the way down now, just to our listening events, which I think are really important. If anybody wants to see the rest of this report, you can find it as our pinned post on our Facebook page on Raham Project. And the couple of slides that we've just skipped through talk about the kind of information we've created. So I'm just going to, like I said, skip through that and go straight to our listening events. This is something that we do every month, and we've hosted 8 in the last year, and we've had about 20 people turn up to them and share their stories. And every single mum that comes to us, we offer them all one-to-one support if they want to sit and have a chat afterwards, or if they want to just debrief about anything, or if they want any extra support, any signposting, any connecting. We ensure that we're there for them. And a lot of mothers who have come to us have often said, I would quite like to talk to somebody about what happened to me, because I feel maybe it wasn't right, or maybe I want a debrief. Or that is a good outcome for us, because I don't think ethnic minority women's or women's and families' voices are are not collected very well from hospital kind of feedback forms. And I think there's lots of reasons for that, but it's not happening as well as it could be. So I'm really grateful that a lot of these mums are feeling brave enough to speak out about them. And this then brings me on to some of the feedback that families have given us. So I'm just going to go through a couple of the stories that they've shared with us. I won't go through them all because there's quite a lot on there, so you can feel free to go through them kind of in your own time. And these are mothers from all over the UK. Although we're based in Peterborough and a lot of the stories are from around Peterborough, Cambridgeshire area, we've ended up connecting with mums from Leicester, Birmingham, Nottingham, Newcastle. So it's been really amazing how many mums have caught on to the fact that, we can come and speak here and we feel comfortable. So this was one of the mums who shared her story with us. With my first baby's labour, I felt anxious. I was in pain and screaming. The midwife was sniggering and making fun of me, saying, "What will you be like during your actual birth?" Staff who came in saw my headscarf and kept asking, "Do you speak English and do you understand what I'm saying?" If they made an effort to glance at my notes, they would have seen I didn't need a translator. The doctor came in as I was half dressed and not wearing my hijab. He just knocked and then barged in. I called out to say, "Just a minute," but he didn't wait. And this is one story of many stories that we hear. And actually, a lot of the common themes are feeling unsupported, feeling unheard, feeling like they were being judged or discriminated because of the way that they looked. Particularly, I've heard a lot from women who wear hijabs actually that there's not this awareness about how important modesty is for this community. who chooses to wear a hijab. And so I think there needs to be a bit more awareness from service providers about these sort of things that are very important to these families. We often hear of families talk about how we would have preferred a female practitioner, and some have been mocked by staff about this, the NHS, you don't get to choose that kind of stuff in our country. And to be fair, that's slightly racist as well. This is everyone's country. But a lot of themes have come up that I've sat and I've listened to and realized that more needs to be done for our services. So I feel like, in the wake of the Ockenden report and in what March with Midwives that Maddie was speaking about have been saying, because essentially there's a lot of crossover with both those things. I think the key fundamentals are we need to listen to the service users and we need to nurture them and nurture the people that care for them. It's about bringing both of these things together. And so I'm going to scroll past the rest of the stories. There's about, I want to say about maybe about 12, 13 on there that you can have a look at if you want to. But I'll move forward to some of the other key achievements that we've had. So we hosted our first birth time documentary screening, which was a really big deal. I am going to say I'm very human about life. I'm a mum. I run this organization, and as everyone has loads of competing priorities, I also work clinically. So for me, it's always hard to find the time to do these sorts of things. So this was my first step into wanting to start doing community engagement in person. So it was very successful. We had about 45 tickets sell, and lots of people came from different backgrounds and different communities. And it was such a lovely space to share, just to talk about birth and reflect on what's actually happening in our current, maternity care systems. So that was a real win for me that day. In the last year, we've had about 105 mums connect with Raham Project, and we've linked about 25% of them, so a quarter of them, to relevant further support, which I think is, again, another win for us. Regarding our advocacy, one of the things I've started noticing more and more over the last couple of months is there are mothers, and these are some of the examples that we shared where we've supported them, who are in patients in maternity units, and this is all over the UK actually. So not necessarily down to just one area, but they're in patients, yet they are calling us for information. And could you just explain what this word means? Or could you just, go through what this might mean? And actually, I feel like we must be failing people if they are under the roof of a maternity care system and they're having to come speak to people outside of that to find information when they've got skilled professionals all around them. So I hope that just gets people to reflect. And I know it's really busy and I know it's really hard. Just pause and sometimes just, engage in a conversation, just take that little bit longer, just to make sure people have asked all the questions that they want to ask, and give them the space to guide the conversation as well, as opposed to leading it how you need to as a healthcare professional. And last but not least, our other achievements. These are all of the other kind of organizations that we've ended up linking with and doing a bit of work with. We were nominated for 2 awards, which we're very proud of, and we were shortlisted and runners up for each of them in our first year of existence. So I feel like this is, just the start of what we've been doing. And I'm hoping we're going to move forward and create real, cultural change in our local maternity area. So that's all I've got to say. Thank you for listening, Sue.